So one question we're often asked is, do dental implants hurt? Which is an entirely understandable question. Often people are very anxious about going to the dentist, just going to the dentist anyway. So having what we call an elective surgery and understanding that there's going to be a little nick made in the gum and there's going to be some work on the bone, it can be quite a worrying and daunting experience for lots of people. But the great news is that the local anesthetic that is used is exceptionally strong. The gum and the bone just soak that anesthetic up, just like a sponge. So actually, probably the worst part of the procedure is actually having that injection. And we can use some topical gels to make that a little bit more comfortable, take our time when we're providing that local anesthetic. So it's a little bit of a gentler procedure. And on the whole, that should be a fairly comfortable procedure. Then once you're lovely and numb, we can then start the process. So you feel a little bit of pressure, you'll feel a little bit of vibration, there'll be a little bit of pushing and pulling. Other than that, shouldn't feel anything at all. And after the procedure, then you're going to know that something has happened. So we tend to recommend analgesics, and that might be in the form of something like a paracetamol or something like a non-steroidal analgesic, and that might be ibuprofen. There's some debate about which ones are preferred, and there's some evidence that some work better than others and some can have an influence on the healing. So just listen to what your clinician suggests. Usually, most of the feedback that we get are that within 24 hours or so, most of that discomfort, if there was any discomfort at all, has gone. Other things that you can do are just take it nice and easy. We recommend just taking it easy with regards to physical exercise, just having a little bit of rest. And maybe you might be advised to use something like an ice pack or a cold press and just put that on the outside of the face, nice and gently, just to reduce any potential swelling or bruising that can sometimes occur. Again, these are rare and it doesn't happen very often, but all these little things help. We often recommend a more softer diet and avoid eating on the area where you've had any surgery, and certainly avoid lifting the lip and having a good look, because often you've had some little sutures or stitches placed in there and you can pull on those stitches and you don't really want to be pulling on that gum. We sometimes advise a modification to your oral health routine. So we might suggest that you avoid brushing that area, and you might be advised to use some warm salt rinses, or you might be given an antiseptic rinse just to help you out. And you might be provided with a softer toothbrush, and you can just brush everywhere else and then avoid that area. And we recommend that you avoid that until, if you used resorbable stitches, until those stitches have dissolved, and then gently brushing the area. Or if you're having stitches that are being removed, when you go back, the clinician will have a little look at that area and then give you some advice on how to proceed with your oral hygiene regime. But to answer the question very simply put, do dental implants hurt or are they painful? And pretty much no, they're not painful at all. It should be a pretty much comfortable procedure.